Currently, I'm seeing an emergency, so before entering the scene, I must ensure that the scene is safe to enter and as well as there are no signs of danger. So apparently there's none, as well as check if there are any available first aid provider. So apparently I'm alone, so I'm in charge of providing the first responder responsibilities. So before approaching the patient, make sure to do a substance isolation precaution by sanitizing your hands. Wear gloves and mask if there is any available. Then approaching the patient. Hey sir, are you choking? So the patient is not getting enough air, can speak in complete sentences, and apparently the skin is starting to turn pale. So I'll be providing care first. Hello sir, my name is Abantao and I'm a trained first aid responder. So apparently you're choking, so I'll be doing an abdominal thrust and back blows and CPR if necessary. Is that okay? Okay, so I'll be doing back blows. So I'll position myself behind and slightly beside the patient, positioning one of my arms in front of his chest and bending the patient forward. Then doing back blows 5 times in between the shoulder blades. 1, 2, 3, 4, 5. And check if the obstruction is seen. So apparently it's none, so I will proceed to abdominal thrust. So I'll position myself behind the patient, putting my hand 2 fingers above the navel in a fist position and then covering it with the other and doing an abdominal thrust in an inward-outward motion 5 times. 1, 2, 3, 4, 5. And check if the obstruction is seen. So it's still none, and now the patient is unconscious, so I'll position the patient in a supine position, preparing for CPR. So now it's time to call. So I'll be calling the Lower Bakayan Emergency Medical Services. So hello, I'm Trisha and I'm here to report an emergency. A patient is choking and currently unconscious. Yes, here in Lower Bakayan, Christina North. Yes, so you may contact me into 956-027-877. Yes, care has been provided, but still the obstruction has not been removed. Okay, I'll keep the call on hold. So, because the patient is unconscious, I'll be doing a CPR, 2-inch deep 30 compressions. So, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So before giving 2 rescue breaths, do a head tilt chin lift, and check if there's if the obstruction is seen. So the obstruction is seen, so remove it. But if the obstruction is not seen, it is not advisable to provide a blind sweep. And now the patient is conscious, we will position him in a recovery position. Wait until the emergency services arrive to assess the patient further.